All right, so basically here we're just trying to look at the clinical uses of H1 receptor antagonist, okay? These are basically drugs that will inhibit the action of histamine at the H1 receptors. You know that the histamine, before the histamine can actually act in the body, it needs receptors like the H1 receptor, H2 receptor, H3 receptor, H4 receptor, okay? And sometimes actions of histamines can get out of hand, like allergic reactions and inflammation. So you actually need some drugs that can actually stop the action of histamine. So there are some drugs that can bind to the H1 receptor and they antagonize or they oppose the action of histamine, or since they are binding to the receptor, they are occupying the space where histamine is supposed to be at. Do you understand? So since they are occupying the space where histamine is supposed to be at, histamine is not finding receptors to bind to, so the effect of histamine is being reduced. Okay? So what are the disease conditions that histamine or too much action of histamine can cause? And how can we be able to use these drugs, okay, that prevent the binding of histamine at the H1 receptor level? Okay, how can we be able to use these drugs to actually treat a lot of medical conditions? Now, these are the histamine antagonists, basically drugs that when they bind to the histamine receptors, histamine will not be able to find a receptor to bind to. You understand? So histamine action will now be controlled. So the histamine H1, the H1 receptor antagonists, they are used in treatment or prevention of symptoms of allergic reactions. Okay, so when histamine actually wants to cause all these allergic reactions, it is most likely to bind to H1 receptors. So if you find a drug that is blocking the H1 receptors, then histamine will not be able to cause allergic reactions again. All right. So they are in bronchial asthma. However, where several mediators are involved, H1 antagonists are largely ineffective, right? But where several mediators are not involved, H1 receptor antagonists are what effective. Do you understand? So they are useful in treatment and prevention of motion sickness disease. Okay, H1 histamine H1 antagonist is also used to treat nausea, vomiting, dizziness associated with motion sickness, right? So the feeling of vomiting, which is nausea, you vomiting, that's like expelling gastric content, and you feeling dizziness, right? You can use a H1 receptor antagonist to actually treat all these medical conditions. It's also used to treat allergic conditions like what? Allergic rhinitis, vasomotor rhinitis, allergic conjunctivitis, allergic reactions, and mild allergic reactions. Okay, so guys, that's it about the clinical uses of H1 histamine receptor antagonist drugs. All right, that's it, guys, and bye for now.